Hello, my name is Brian Budgell and I would like to welcome you to this presentation which I have entitled Subluxation and Semantics. Now, I believe most practitioners would agree that the subluxation is a core concept in chiropractic, and we even have a couple of official definitions to tell us what a subluxation is. However, in truth, and especially when we're students and new graduates, we may not have a clear conception in our mind of what the subluxation is. And so the purpose of this presentation is to help us understand in concrete terms what people mean when they use the term subluxation. And we will achieve this using the rigorous methods that linguists use to derive the true meanings of words. This is an area of linguistics often referred to as semantics. Let's get started. The prototypical model of the chiropractic subluxation, as articulated by D.D. Palmer, was a vertebra out of place, impinging on a nerve, and thereby altering nerve function. However, Palmer was not the originator of this definition, as it had been conventional in the medical literature since well before Palmer's birth. Our colleague, Alan Terrett, of RMIT University in Australia, has traced the concept of vertebral subluxation at least as far back as the mid-1700s. A century before the birth of Palmer. Based on Alan Terrett's research, it appears that a number of medical authors of the 1800s picked up on this idea, concluding that minor displacements of vertebrae impinged on nerves and even proposing that subluxation at different levels of the spinal column promoted disease in different organs. Furthermore, it appears that well before Palmer's birth, the kinds of manipulations that he called adjustments were being practiced by the English doctor Edward Harrison. In his biography of Dr. Harrison, the historian Bob Pendle described how this doctor had a seminal experience very much like that of D.D. Palmer with Harvey Lillard. In Harrison's case, the incident involved a man falling from his horse and lying paralyzed on the ground. Harrison described instinctively bracing and tractioning the man's neck and then manipulating something back into place, whereupon the lucky man made an instantaneous recovery. Dr. Harrison referred to his manipulations as adjustments, and he appears to have used much the same technical approach as Palmer later advocated. The prototypical definition of subluxation was based on good current knowledge of human biology, in particular anatomy. However, the advent of radiology created some difficulties for the bone out of place definition because, quite frankly, in most chiropractic patients, it was very difficult to visualize vertebrae which were convincingly out of place. Furthermore, as cinematography developed at the end of the 1800s, human biologists became more aware of and could map the constant motion of the human body, establishing that there was really no normal or neutral position from which vertebra could get out of place. As the prototypical model of subluxation has languished, people have cast about for other models, and what they may have thought of as better terminology. Within the profession, there is a diversity of opinions on what a subluxation is and the best choice of terms. Unfortunately, within the chiropractic profession, there are still attempts to prescribe or forbid unacceptable words and phrases, and to force patterns of language upon us. History teaches us that such attempts to force language on people are seldom successful. And this leads us to a central point of this discussion. Chiropractors have relied on a very archaic methodology to arrive at the definition of subluxation. Specifically, they have looked for or tried to assume the authority to define words. This is an outdated approach, long ago abandoned by linguists. Linguists, the people with real expertise in the meanings of words, seek evidence-based definitions of words. Let's look at what that means and how those methods might be applied to the lexicon of chiropractic. Since the advent of modern computers, linguists have taken a more robust approach to deriving the meanings of words. They analyze corpora, large electronic collections of the target language, and then they work backwards from people's use of words to try to figure out what the words actually mean to users. Linguists would say that the meanings of words reflect the consensus of what they would refer to as the language community. Words or their definitions are not the property of a few self-appointed experts. Here we've analyzed approximately 1.4 million words from the original curriculum of Canadian Memorial Chiropractic College from 1946. Once we filter out everyday words such as the, and so forth, we can make a statistical comparison to the modern chiropractic curriculum. The results are represented in this word cloud, which is packed with nouns related to the structure of the human body. A closer examination of the actual sentences containing these keywords shows that health was regarded as related to neurological function, which in turn was influenced by the biomechanics of the body. Sentences and phrases containing the word subluxation are aggregated here in a so-called word tree. The patterns imply that the subluxation was seen as a vertebra which really was out of place and really interfering with the function of the nervous system. In other words, a semantic analysis confirms that the archaic or prototypical definition of the subluxation was still a strong influence in Canadian chiropractic education going into the second half of the 20th century. Later, we performed the same sort of analysis using the contents of the curriculum at CMCC from 2010. We examined 39 courses looking at more than 3 million words of text. In total, there were 1,777 examples of the word subluxation, but by eliminating duplicates, we finally identified 573 unique examples of usage, and we were able to discern 3 naturally occurring meanings. These were, first, the actual instantaneous injury that resulted in pain. We called this the subluxation event. Next was the syndrome of signs and symptoms that the patient presented to the doctor. We called these the clinical subluxation. And then there was the description of the underlying tissue damage, what we called the subluxation lesion. The instantaneous occurrence of the subluxation was portrayed as a biomechanical failure of some stabilizing element of the spine. Here are some examples of that usage. The clinical syndrome was all of those signs and symptoms which clinicians normally use to form the diagnosis of subluxation, or fixation, or restriction. The subluxation lesion was what people thought was going on under the skin and causing the patient suffering. Be careful, because these descriptions are almost always hypothetical rather than direct observations. In summary, don't be confused when you hear different definitions for subluxation. It may be that people are using what seems to be the same word to actually describe 3 or more different things. One person may be talking about, for example, the subluxation event, while the other person is using the word to describe the clinical syndrome or the underlying lesion. They are not actually disagreeing, but rather failing to understand the context within which the other person is talking. Interestingly, today subluxation remains the most prevalent term used at CMCC to refer to the target of spinal manipulation. This is not because it's the perfect term, but rather because no one has yet come up with anything better. Thank you very much.